Hi, Kyle. Good morning, Shai.
Hi.
Hello.
How many days do you work? I feel like we've seen you every day that we've been here.
Yeah, I've been picking up some overtime lately.
Wow. Well, it's nice to have a familiar face.
Oh, I think it's Monday. Well, it's nice to see you guys again, too.
Yeah, we're ready to get out of here.
Couple more days. Do you have any topics on your checklist here that you wanted to discuss today?
I'm just feeling so rotten. I mean, the food here tastes like vomit, and I want to vomit. Nothing tastes. I can't remember anything hardly. It's just I just feel so terrible.
And I've noticed his mouth is really dry and his breath is atrocious.
Thank you.
You're welcome.
There's a lot of symptoms it seems you're having. I'd like to address them all. For starters, let's talk about your nausea. I see that you have an emesis bag there. Have you been throwing up?
I haven't yet, but I feel like consumed by this feeling. And food, every time I've tried to eat, nothing tastes right.
Well, having these changes in your taste buds are one of the side effects of the chemo. Typically, it's not a permanent side effect. It should go away within a few weeks after you've had the chemo. I have some information on that I can get for you, similar to these other handouts that you had in your packet here. I've got some on taste alterations and some on nausea as well that I can get for you.
I don't understand how a drug going through that thing that's in his arm can affect his mouth. I mean, to me, it doesn't make any sense. Look how young he is and he's in shape. Why would this be happening to someone like that?
It's another really good question. The reason for that is that chemotherapy drugs really affect the entire GI tract from top to bottom. That's why you have a lot of these symptoms in your mouth. And the reason for that is because the cells along your GI tract, your mouth, your throat, your stomach, your intestines, those cells turn over very quickly, and the chemotherapy is destroying those cells and it's harming your whole GI tract. So that's why you have the nausea and you might have some sores in your mouth, all the dryness. So for the dryness, there's some things we can do to help combat that. We can talk about that shortly. I can also get you some medication for the nausea.
I don't think so. We're not really a family that likes to take medicine. I've heard that those nausea meds are really addicting.
I understand your concerns about that. Nausea medications actually don't cause addiction. And
Are you sure? Because I read it on the internet, so.
If you have a look at some of these resources we discussed last week, most of these websites discuss symptoms such as nausea and vomiting, and they do discuss some of the medications that we give. And the medications are designed to act in various parts of your treatment to combat nausea before your chemo, during your chemo, and after your chemo. And when you're taking those medications, they're usually quite effective. We have a variety that we can use to help with your symptoms. And once your nausea is gone, you don't need those medications anymore.
Sometimes I burp and it smells like an old boot.
Yeah, that would be another symptom of your GI tract is really being affected by the chemotherapy. So some things we can do, I can give you some mouthwash to help with that. We have a nice gentle saline mouthwash that we like you to use. And that is something we discussed a couple weeks ago up here on the expectations, that we want you using that saline mouthwash.
Okay.
I'm kind of thinking maybe we should talk to your uncle who's a chiropractor before we take any of these meds. Because I want to hear his professional opinion first before we. I mean, he seems to know best. So.
I don't know. They're the experts here.
I don't know.
We've got all these resources, and I'm really here to help answer your questions, and I'd be happy to answer any other questions you have. I know it can be very scary to try all these new medications.
Do you have anything else that's not medication related that we could try first, so we don't have to jump right to taking meds?
We do. We actually have a great integrative medicine program here, and it's a new department here at Mayo Clinic. And we have this pamphlet here. It's got a list of the services they provide. They provide information and can help you with supplements, and botanicals, which can help with nausea and vomiting.
Do you guys do like oils? Because we love essential oils.
We do. We have essential oils here. We can get you some that can help with the nausea as well. And you can look through this integrative medicine pamphlet to see if there's any other services that you think might help.
Now, do you think that'll help with the burps? Because
It's really all related, so yes, I think it could be quite helpful. And remember that this is typically confined to the time when he's undergoing treatment, and that this all should pass.
all right. I did have another question for you while you're here. So I was looking at Mayo Clinic the portal you guys gave us, and yesterday I didn't have a lot of red stuff on here, but today it's like his whole list is red, and I don't know what any of these words mean. There's like a Nutrifile or something like. What is that?
First, I'm really glad to hear that you're using the patient portal. It's great to see that you're trying to stay up to date on Kyle's labs and all of his care.
Oh yeah, because I handle everything, so I have to be in the know.
Okay. Well, I have some information here in the packet that can help you with some of these questions. First, we have this blood cell formation chart that explains the how blood cells are formed from the bone marrow, each step they go through, and it explains the purpose of each of the types of blood cells, the normal range, which explains why a lot of his cells, his lab results are showing red. It's because they're not within the normal range.
Okay.
And it shows some side effects of having those blood cells outside the normal range.
Oh,
And
that's
some
probably
things
why
we
you're
can do
so
to help.
tired today.
That's exactly right. This is another one here, this blood and bone marrow handout that we have. It has more information and some more pictures about how the blood cells are formed.
And do you have like a book that has any, like if I want to look up, the doctors come in every morning and my goodness, they just, I don't know, understand what they're saying. Is there something that maybe while they're talking I can write down the word and look it up so that I actually know what's going on? Because they're in and out in a matter of 30 seconds.
They could be speaking Greek,
That's true.
and we don't speak Greek.
No, only Spanish.
Yep, I understand that's really confusing, and yes, absolutely. We have this handout here from the Leukemia and Lymphoma Society, and this little booklet has a great glossary in it that has lots of information on all the different new words that you guys are learning
Okay.
through the hematology world. Information about different types of blood cells, what they mean, a lot of the information you're seeing in these other resources.
Oh, good.
So this glossary, it's pretty much this whole book.
Okay, good. So I can just look up the words. I can even write them right here.
Yep, blank pages at the end, so
Oh,
you can
awesome.
write down the
Great.
things you need to look up. And then again, remember, we don't want you Googling the names of these words. So if you have further questions, of course, please ask us.
Okay.
Or remember to use your resource list.
Okay. Did you want to ask her about me forgetting stuff all the time? I'm a little bit concerned. I mean, you forget stuff at home all the time, but I just chalked it up to you being a man, so.
Yeah, I mean, yeah, my memory is not the same as it was. It's like I'll leave stuff. I leave my keys on the table, and then I don't remember where I put them, and it's
It's really frustrating.
I understand. That's a fairly common complaint actually after patients have been going through chemo. And it's an unexplained phenomenon. We call it chemo brain. And we have a handout here as well. And this we actually have from the Mayo Clinic website. So if you go on our website, there's more information about chemo brain. And it talks about some things you can do, some tactics you can do at home to help combat these symptoms, and some supportive techniques to help improve your memory.
wow, thank you.
You're welcome. Are there any other questions I can answer for you today?
Gosh, that's a lot of information.
Thank
I know
you.
it is. So that's what, remember you've got all this information here. I want you to take this with you.
Do you think we can check things off now that
Yes.
we've covered a lot of this stuff?
Absolutely. Let's mark off. I'm just going to put the date we discussed some of these things
Okay.
here. Good.
Shy, can I have some Purell, please?
Oh, sure. Gotta keep those hands clean.
Okay, well I'll come back and check on you guys later. You guys just call if you need anything, okay?
Thank you.
Thanks.